The second type of diabetes is type 2 diabetes. This type usually occurs after age 40, but not common in younger adults and teens due to our poor lifestyles. It is primarily caused by insulin resistance, but not just that. So let's break it down. First of all, insulin resistance. This is when our body cells, especially the muscle cell, fat cell, and the liver cell, don't respond properly to insulin. As a result, glucose can't enter cells efficiently, so blood sugar level rise, leading to what we call compensatory insulin production. Here, the pancreas senses elevated blood sugar level, so it begins to produce more insulin just to overcome this resistance. So over time, it can wear out or get dysfunctional, resulting to relative insulin deficiency. So at this point, the pancreas is no longer able to meet up with the body increased demand in terms of insulin production. So the next one we're going to talk about is the triggers. Let us understand something. Insulin resistance doesn't appear out of nowhere. Talk more of leading or resulting to compensatory insulin production. No, it is often triggered or worsened by certain lifestyle factors and metabolic factors. 1. Obesity or overweight. What happens is that the excess fat in the body blocks the cells from hearing the insulin signal, or it blocks them from responding to insulin signal, especially the belly fats. So when there is too much fat, the belly fat cells, we call them visceral fat cells, it gets enlarged, and at some point they begin to release chemicals that confuse the cells. There is more to it. So overweight or obesity is one of the factors that trigger insulin resistance. So the second one is poor diet. For instance, rapid digesting products. For example, we have high processed foods, then high sugar products. So what happens there is that this particular product, when taken in large portion, because they are being digested easily or rapidly, they get digested and broken down to glucose in the blood. So because the pancreas is trying to meet up with the body's demand, just to control much sugar in the blood, they produce more insulin. And if this happens often, the cells of the body will get tired of the insulin. It's just like you're knocking on somebody's door every day. You see that the person gets tired. Why is this person always disturbing me? So this is what happens. You have to also understand that so much sugar in the blood is stored as fat. So when there is excess fat in the body, then there is a problem too. So poor diet is one of the factors that also trigger insulin resistance. Then the third one is hypertension. So people with hypertension are prone to developing type 2 diabetes. The fourth one is genetic predisposition. Genetic predisposition here simply means this individual has a family history of type 2 diabetes. Right? So not just having the family history, not just it being common, meaning that the individual has the gene that is linked to insulin resistance. So now there's also a gene that is linked to beta cell dysfunction. Yeah, beta cell dysfunction can also be seen as another cause of type 2 diabetes. Right, so but the primary cause of type 2 diabetes is insulin resistance. So beta cell dysfunction can also be caused by insulin resistance. But there's another cause. We have glucotoxicity. So this is a situation whereby long-term high blood sugar damages the beta cell, resulting in beta cell dysfunction. Then there is lipotoxicity. Then there is also a genetic predisposition, that is the presence of this gene that is linked to beta cell dysfunction. So, but we can see it as another cause of that, but the primary cause of type 2 diabetes is insulin resistance. So now, the next factor is physical inactivity. Here is that you don't do anything. Every time you are seated, you have someone doing everything for you. You can't even take a walk. So what do you expect? Do you expect the body to keep taking glucose and you're not using it? It doesn't make sense. So physical inactivity is one of the factors that trigger insulin resistance. Try to take a walk. Try to exercise. It helps a lot. So type 2 diabetes, it's actually as a result of our poor habits. Because even if this individual, or even if an individual has this gene, it must have to be triggered by our lifestyle factors. Yeah. So type 2 diabetes is as a result of our poor habits. The third type of diabetes is gestational diabetes. This type usually occurs in pregnancy, but can still predispose one to type 2 diabetes. So in gestational diabetes, what happens is that the pregnancy hormone makes our body more insulin resistant. So there are factors that can also trigger it. So because even when this hormone makes our body more insulin resistant, it doesn't just happen to everybody. There are certain factors that trigger it. We can call them risk factors. Number 1 is overweight before pregnancy. 2 is old age. 3 is previous gestational diabetes. The fourth one is family history of gestational diabetes. So these are factors that can trigger gestational diabetes. So having known what diabetes is all about, its meaning, types, causes, still stay tuned because in my next video, I'll be talking about the symptoms, how to prevent it, how to manage it, and also how smoking and excessive alcohol consumption is linked to diabetes. Thank you and God bless. Bye.